My name is Dariusz Borys. I'm orthopedic pathologist and director of digital pathology at Loyola University Medical Center, Chicago. Today, I'm going to talk about updates in digital pathology, and thank you for staying with me. So first, what is telepathology? Telepathology use of telecommunication technology to transfer image-rich pathology data of digitalized slides between remote locations for diagnosis, education, and research. Digitized pathology slides involve digital capture of the entire microscopic slides. To digitize microscopic pathology slides, you need automated whole slide imaging system which include hardware and software. Hardware includes scanner which is composed of an optical microscope and digital camera connected to computer. Software is responsible for image creation, management, viewing of image, and image analysis. In our institution, we use Leica eManager software to access server with stored digitalized slides and retrieve remotely images by using web address pathscope.lumc.edu. So, what are differences between optical microscopy and digital pathology in daily practice? Optical microscopy requires microscope on the side to view microscopic slides, comparing to digital pathology where you can analyze slides using computer screen on site or remote place. You can only analyze one slide at a time with optical microscope, comparing to digital software where you can analyze multiple slides with integrated viewing. Optical microscope is limited to manual analysis, comparing to digital software analysis with integrated software algorithms. To retrieve old slides from archival for optical microscope, you have to ask technician to bring you the slides from storage, which may take some time. With digital software, you can retrieve and analyze the slides in minutes, which is important for clinical patient care. Remote viewing of slides using optical microscope is not possible unless you have attached camera. With digital software, you can retrieve slides anywhere and anytime. These examples show how flexible and important for clinical patient care is digital pathology comparing to optical microscopic analysis. The main application of digital pathology would have important role in archival and retrieval glass slides, clinical consultation practice, digital pathology consults, intraoperative consults, tumor boards, and immunohistochemistry quantification. Application of digital pathology in archival and retrieval of glass slides. We store glass slides in storage room, and in some cases they are not on the same floor as Department of Pathology. It may take time for the technician to bring you old slides for comparison with present case, especially in cases of metastatic carcinoma. With digital pathology, you can retrieve previously scanned slides in a short period of time for evaluation using computer screen, which would be important for patient care. The next important point for using digital pathology are outside pathology consultation. If pathologists need outside consultation in difficult cases, he needs to send them by mail to specialized institutions, which may take even a week in some cases. With digital pathology, you can connect remotely with consultant and discuss this case in real time, which will have important advantage in patient clinical care. Who would benefit from digital pathology in clinical pathology practice? Essentially, any pathologist, but solo pathology practice would benefit the most. Benefits would include consult for difficult cases or difficult intraoperative frozen sections, second signature for malignant diagnosis, guidance on working up a case, quality assurance, and vacation time coverage. Other important application of digital pathology in daily clinical practice is intraoperative consultation, also known as frozen section. By using WSI, you can do intraoperative consultation remotely, which may have important impact on patient care in remote practices and during night surgeries. I had few cases of intraoperative consultation during the night. Driving to the hospital, it would take me an hour, especially during winter time. This would cause patient waiting anesthesia for diagnosis an hour. With digital pathology, I was able to evaluate frozen section in minutes and report diagnosis to the surgeon. Other aspects of digital pathology are tumor boards. It really helps to build good pathology, radiology, surgery teamwork. It really helps to better understand histopathology of the case when you can evaluate whole slides digitally and build better understanding between subspecialties. Digital immunohistochemistry quantification would allow for improved workflow and more accurate results. Digital pathology is a great tool for pathologists for daily clinical practice, but we cannot forget about clinical regulations, quality assurance, and validation. First paper about validation whole slide imaging for diagnostic purposes in pathology was written by Dr. Liron Parnasowicz at Aliquots in 2013 and was guideline from the College of American Pathologists, Pathology and Laboratory Quality Center. Conclusion of that publication was that validation should demonstrate that the WSI system under review produces acceptable digital slides for diagnostic interpretation. The intention of validating WSI systems is to permit the clinical use of this technology in a manner that does not compromise patient care. This table from the publication shows 12 guidelines of validating whole slide imaging systems for diagnostic purposes in pathology. I would highlight a few of them. All pathology laboratories implementing WSI technology for clinical diagnostic purposes should carry out their own validation studies. The validation study should closely emulate the real-world clinical environment in which the technology will be used. A pathologist adequately trained to use the WSI system must be involved in the validation process. The validation process should include a sample set of at least 60 cases for one application, for example, H&E stains or cytology, that reflects the spectrum and complexity of specimen types and diagnoses likely to be encountered during routine practices. The validation process should include another 20 cases for each additional application, for example, immunohistochemistry or special stains. The validation study should establish diagnostic concordance between digital and glass slides for the same observer. A washout period of at least 2 weeks should occur between viewing digital and glass slides. The validation process should confirm that all of the material present on a glass slide to be scanned is included in the digital image. So the race between companies producing scanners started to validate their whole slide imaging system and be approved by FDA. FDA approval would allow pathologists to sign out cases digitally as primary diagnosis. First approved system was Philips IntelliSight Pathology Solution PIPS in 2017. More companies were working on FDA approval. However, in meantime, COVID-19 epidemic started in the beginning of 2020. There was a need for remote work and social distancing. During that time, College of American Pathologists and Association for Pathology Informatics wrote letter to US Department of Health and Human Services for emergent use of digital pathology for performing remote rendering of pathology diagnosis using digital system with internal validation. In March 2020, Center Medicare and Medicaid issued memorandum in which CMS ensured pathologists may review pathology slides remotely during the COVID-19 public health emergency. In April 2020, FDA approved Aperio Web Viewer and Aperio AT2 scanner for primary pathology diagnosis during COVID pandemic emergency. This is the newest publication by Andrew Evans and colleagues titled Validating a Whole Slide Imaging System for Diagnostic Purpose in Pathology, which is a guideline update from the College of American Pathologists in collaboration with American Society for Clinical Pathology and the Association for Pathology Informatics. In conclusion, highlights that systemic review of literature following release of the 2013 guidelines reaffirms that the use of a validation set of at least 60 cases, establishing intra-observer diagnostic concordance between WSI and glass slides, and the use of 2-week washout period between modalities. Although all discordances between WSI and glass slide diagnosis discovered during validation need to be reconciled. Laboratories should be particularly concerned if their overall WSI glass slide concordance is less than 95%. This is table from the publication and show new updated summary of good practice statement. Based on new updated recommendations, College of American Pathologists issued recommendations for validating whole slide imaging systems for diagnostic purposes in pathology. Guideline statement include 3 recommendations. Recommendation 1. The validation process should include a sample set of at least 60 cases for one application or use case. For example, H&E stains sections of fixed tissue, frozen sections, hematology, that reflect the spectrum and complexity of specimens types and diagnoses likely to be encountered during routine practice. The validation should include another 20 cases to cover additional applications such as immunohistochemistry or other special stains if these applications are relevant to an intended use and were not included in the 60 cases mentioned above. Recommendation 2. The validation study should establish diagnostic concordance between digital and glass slides for the same observer. If concordance is less than 95%, laboratories should investigate and attempt to remedy the cause. Recommendation 3. A washout period of at least 2 weeks should occur between viewing digital and glass slides. So in conclusion, digital pathology has wide healthcare application, including primary diagnostics, diagnostic consultation, intraoperative diagnosis, medical students and resident training, clinical medical research, and tumor boards. Validation of whole slide imaging system is important for clinical use to not compromise patient care. WSI systems were allowed to be used for primary diagnosis during COVID-19 pandemic emergency. College of American Pathologists issued recommendation for WSI system validation in 2021. Philips IntelliSite pathology solution and Leica 82 WSI system were approved for FDA for primary pathological diagnosis. Thank you for staying with me today, and I'm ready for questions. Thank you.